Doctors, what's the scariest thing a patient has ever done or said? The scariest thing I ever heard working in healthcare was not from a patient, but a nurse who called me to report an outbreak of rabies at one of the nursing homes I worked in senior management for. I managed to stop myself freaking out for long enough to ask her the necessary questions. And thank goodness, English wasn't her first language and she'd got like two words confused. Scabies. She meant scabies. Alright, so if someone told me there was an outbreak of rabies among the elderly, I'd be picturing some kind of weird geriatric zombie scenario. Story 2. Not a doctor or a nurse. One of my uncles had stage 4 pancreatic cancer. He was a tough guy and didn't trust hospitals, so he didn't see a doctor until it was way too late, despite being in debilitating pain. When he did, the prognosis was grim. He had maybe, 6 weeks left, and pancreatic cancer is a painful way to pass away. He decided to get MAID instead, medical assistance in passing away, which is legal in Canada. On the day we were all gathered around his bed, all the paperwork and permissions were sorted out and the syringe of substances was connected to his IV. He was heavily sedated, but he had to be the one to push the plunger, which he did with the help of his wife. He closed his eyes and his breathing got very shallow and slowed down. After a few minutes, we thought he had passed. We were all standing around him, some saying goodbye, a lot of people were crying. About 10 minutes passed and people started to leave when suddenly, in a strong, clear voice, he said, "Russell, wait for me." Then he was gone. Nobody knew who Russell was, and it was kind of a mystery we talked about from time to time. Years later, his wife passed, and when his kids were going through her things, they found a very old photograph of him when he was maybe 5 years old. He was in a sandbox with a small dog. On the back of the picture, in faded ink, it read, "Russell, 1944. The thought that our pets that have gone before us meet us to help us cross over fills me with comfort. I hope it isn't just a mind trying to make sense of a crazy time. You guys remember the movie Up with the character Russell? Kind of thought the same thing, but that one got me teary-eyed too, where I guess we're all just little kids, even at the end. Story 3. Not a doctor, but before my grandfather passed of pancreatitis, I'll never forget when he looked up at me and told me that, "Don't worry, they're already here, all of them," before passing away. Not really sure what that means or meant, but it creeped me the heck out for a few years. On a lighter note, my other grandpa passed away a little bit after I walked into the room with a new mustache I was trying to sport. He laughed at it, and I like to think about that sometimes. The very last thing he did after a full life of ups and downs was a laugh at my stupid mustache. Story 4. Doctor here. The first one that sticks to mind isn't so much what the patient said, but more her body language that clued into what was going wrong. I was a medical student at the time, and the city my school was in is a hub for trafficking. I noticed a patient in the ER who had a pretty bad injury to her face and was with a sketchy-looking guy who was not related to her. She wasn't my patient, but brought my gut feeling up to her doctor, who then made up some excuse to talk to the patient alone and got her to help. Turns out she was a victim of trafficking. I never talked to her myself, but I couldn't shake the vibe I got from looking at her and the man she was with. Story 5. "Doc, I can't wait to have this baby. We'll finally have our baby girl. Now we can stop trying." When I was doing my final year of hospital rotations, I got called into one of the OB ultrasound rooms by the attending. I was just about to leave since my shift had just ended, but decided to see the one last patient since we had such a good shift, and I didn't mind making another patient stay. The attending points to the ultrasound and asks if I can see the heartbeat. I thought she was just quizzing me since I was a med student, and I was internally panicking since I couldn't see it. I apologized for what I assumed was my lack of knowledge. Turns out I was called in to confirm the lack of a heartbeat on this 8-month-old baby in utero. They needed 2 doctors to confirm. I never wanted to be more wrong my whole life. When I was left alone with the patient, she kept trying to convince herself that she was okay, and that she had 3 other children to come home to. But you could tell how devastated she was. Then she said, "I guess I was right. This was going to be my last baby," and then just walked out. I was on call the next day and ended up seeing her through pre-op, the delivery, and post-op. She's one of the patients I will never forget. Story 6. First month as an intern. At this point, I know everything to crush med tests, but nothing to handle a patient. Only doctor covering the night shift at a VA, code green, which at this location means a patient is hostile. Jog around a corner, find Mr. S, who I admitted a few hours earlier, now sundowning and holding a piece of broken glass in front of him like a knife. Sundowning is when an elderly, maybe demented patient has increased confusion plus or minus agitation early in the night, especially in an unfamiliar setting, which every hospital is. He's holding the broken glass towards the charge nurses and screaming nonsense, mainly F-bombs and wanting to go home. Me too, man. 2 police officers are standing a couple yards in front, one touching his sidearm. Nurses and techs are lining in the hallway. Lights are on, TVs are on. Mr. S is not enjoying his stay. Everyone looks at me, the youngest, least experienced. Why not? So, what do you do? First thing, greet Mr. S. I admitted him, so I knew he was a good guy in a confused state. I never mentioned the situation, just started a random polite conversation. Next, motion for the cops to leave, the extra nurses and techs to leave, turn off the TVs, turn off the overhead music, turn off some lights, de escalate everything. And then, with just the charge nurses and I in the hallway, minimal stimulation, we waited him out. Eventually, he forgot what he was holding as we talked about his wife and fishing outside the city. We did end up giving him a sedative once the danger passed. Not sure if I should have, and the next day, we got him home. Story 7. Not a doctor, but a nurse. Once a psychotic, schizophrenic patient got me, and it was because of how normal she said it, screaming, threatening to end me, and then sitting on the commode, and then calmly looking at me and saying in the most normal and monotone voice, "I'm sorry, I know I'm not well and being mean to you. I'm in hell and I don't know how to get out." I will never forget that or how it made me feel. It's like she had a 10-second lapse of her manic episode to apologize and tell me how she felt. Made me super empathetic to my psych patients. Story 8. I've got one. I'm a psychiatrist with a distinct and relatively rare appearance. Because of this, I spent my whole life hearing that I look like anyone with a vaguely similar skin tone or hair color, even when I didn't see the resemblance. Fast forward to my intern year, a patient comes into the emergency department after being found severely hypothermic, so much so that he was initially pronounced departed. Miraculously, he was resuscitated, but his identity was unknown, and as he began recovering, he started displaying signs of psychosis. That's when the primary team called in a psych consult, and I went in to assess him. The moment I stepped into his room, I was taken aback. The man, lying in the bed, was a spitting image of me, except he looked like an alternate version of myself, one who had gone down a much darker path. His face was weathered, likely from substance use and homelessness, but the resemblance, it was unsettling. As I tried to gather details about his identity and psychiatric history, he locked eyes with me, his stare intense and unshakable, and said, "I am you." That became his only response whenever he spoke to me. For 3 days, every time I interacted with him, all he would say was, "I am you." Being a sleep-deprived intern, this messed with my head more than I'd like to admit. Seeing someone who looked eerily like me, who had literally been pronounced departed days earlier, repeating that phrase over and over, it freaked me out to say the least. After a few more days, and as he started coming down from substance-induced psychosis, I finally got through to him. I explained that he couldn't be released as a John Doe, and that we needed his identification. Eventually, he gave me his social security number. When we ran it, we discovered he had multiple out-of-state warrants. The whole experience shook me, and I definitely lost some sleep over it. Even now, it still sticks with me. Story 9. While working as a CNA in hospice, I received a call to assist a nurse with a particularly challenging patient. This woman, who was battling lung cancer alongside renal and liver failure, was also an alcoholic and chronic smoker. She had recently experienced a near-departed event in the hospital, quoting briefly. Following that incident, she became intensely insistent that no man be allowed into her room. When I arrived, the nurse informed me that it wasn't just any man she wanted to keep out. It was a specific individual, and no one could figure out who it might be. Her son hadn't spoken to her in over a decade, with the exception of one visit before her hospital scare, due to her past cruel behavior. Her father was long departed, she had no brothers or uncles, and her husband had tragically passed away decades earlier. Yet, she continued to demand that we not let him in, whoever him was. She soon developed the characteristic doom rattle, and we waited. The room became quiet, and the nurse and I exchanged glances, sensing she had just taken her last breath. Suddenly, she sat upright and began to scream, "He's here! You've let him in! He's here!" Her eyes were wide, her skin pale, and she trembled uncontrollably, staring intently at a corner of the ceiling. We tried to reassure her that no one was there, but as we helped her lie back down, she simply whispered, "He knows. He's smiling because he knows." Within minutes, she closed her eyes, gave one final rattling breath, and was gone. I worked with that same nurse a few months later, and she recounted that when she called the son to inform him of his mother's passing, he told her something chilling. He said that the last time they spoke, he had prayed for something sinister to take her, as she had spent her final exchange trying to use religious guilt to shame him into caring for her in her old age. So, whether the woman was experiencing a fear-induced hallucination or genuinely witnessing something unsettling coming for her, I can't say. The nurse, however, seemed convinced it was indeed something truly dark. She swore she would not return to working in a hospital, stating that she had witnessed enough end-of-life care. Story 10. As a nurse, I once had a patient experiencing substance withdrawal. I asked if I could administer an injection of a particular thinner, and he consented. However, he reacted poorly to the discomfort of the injection. He suddenly got out of bed, backed me into a corner, and threatened me. He claimed he had previously caused the passing of a police officer through violence, and he stated he wanted to do the same to me. He was 6'2", and I'm 5 foot flat. I managed to de-escalate the situation as best as I could by administering his prescribed substances and suggesting he take a walk outside the unit to calm down. This seemed to work. However, before he left the unit, he informed our charge nurse that he intended to harm me. Despite this, management, security, and the doctor offered no meaningful support. I had to spend my subsequent shifts feeling all anxious about potential harm. Story 11. One of the scariest things I've heard as a doctor came from a patient who calmly said, "I see the man in the corner again." There was no one there. The patient was fully alert and oriented, but their vitals were crashing fast. Moments later, they coded. Another eerie moment was a patient who came in after a traumatic accident. Right before surgery, they grabbed my wrist and said, "Don't let me pass away, doc." Their vitals were stable, but despite our best efforts, they didn't make it through the operation. The things patients say, especially in their final moments, can stick with you forever. Story 12. Not really a patient who said it. I was on a trauma shift trauma surgeon and got called in for a bad car accident. When I got there, they were doing CPR and eventually we got her back, stable enough for CT. Another trauma comes in during all this, turns out to be the husband of the trauma patient. My PA went to survey the new patient. She came back, white as a ghost. "John just came in next door as a new trauma. I think that's Emily." I looked at our patient, who we just did CPR on, and almost fainted. I didn't recognize her until I smelled her perfume. She was so banged up she didn't look like herself. I almost retched. Emily was another PA on our trauma team. She ended up passing away a few days later from severe brain injury. "I think that's Emily" will be forever burned on my brain and among the top 3 reasons I don't do trauma surgery anymore. Story 13. Probably not what you were asking, but the thing that I've been most scared to respond to was a 7-year-old-ish girl stopping me, talking to her mom, and first asking me if I was a doctor, which I responded yes to, and then asking me very frankly if her dad was going to pass away. Given that he was intubated on 2 pressors with a multi-substance resistant infection, on top of a hematological malignancy, the real answer was most likely. Striking a balance between remaining honest and not adding extra trauma to her experience, knowing it could be possibly something she carries with her for her entire life. Without preparation, I was on a consulting team, not the primary team, so wasn't on the team designated to discuss goals of care and overall expectations. It was terrifying. So I told her that I didn't know, and her dad was very, very sick, and it might take us a long time to know what would happen, but a whole team of doctors and nurses were going to keep trying their best to help him get better. He passed away several days later. Story 14. As a nurse, I recall a particularly challenging experience from my time as a CNA. A young woman was brought into the ER for behavioral issues, with her family reporting she hadn't slept in weeks. She was initially quiet, but then began to harm herself. When we applied restraint, she became extremely agitated. She screamed, not with words, but with sounds of growling and distress. This continued for some time before she calmed down. Strangely, her test came back negative for everything except a CT scan. Suddenly, the sitter exclaimed, "She got out!" This woman had managed to remove the restraints, causing wounds from the struggle. An RN attempted to intervene and was forcefully kicked in the chest. I sustained scratches, the doctor was punched, and a security guard was bitten. The doctor eventually administered a sedative to calm her. We assumed she would be sedated for a while, allowing us to complete paperwork for injuries. However, within 5 minutes, she woke up and resumed her distressed behavior. This continued throughout the entire night. She was too unstable to be transferred to a behavioral unit, so she remained in inpatient care. It was the longest night of my life. The next day, she was still there. She remained too agitated for a unit transfer, even if a bed had been available. This was during lockdown times. Medical staff still had no clear diagnosis beyond severe sleep deprivation, psychosis, and general deterioration. After several days of this agitated and distressed state, she became unresponsive. We inserted a feeding tube, but her condition continued to decline and she passed away after 9 days. It took our pathologist 8 months to determine what she had, a rare prion disorder. This condition can occur in an astronomically small percentage of individuals who use synthetic opioids. It was the closest thing I have ever witnessed to something truly inexplicable. Story 15. Again, nurse here. Plenty of times I have had patients with psychosis tell me they see a person in the room. This is never scary to me. I don't attend to where their vision is because it makes the hallucination more real to them. I just do a full assessment, figure out if they hear voices, if the voices are telling them to harm themselves or others, encourage them to engage in distractions, talk to them if that's what they need at the moment, and give them whatever meds necessary. Freaks out other nurses though. I've had many dying patients say they finally see members or angels in the room. The patients in those instances never seem scared, more like comforted. I actually encourage them to focus on those family members that they see. If it brings them comfort, they usually pass shortly afterwards. Story 16. Before I begin, I always preface stories like these by saying that sharing them feels like sifting through a filing cabinet of nightmares to pick out the ones that stand out the most. A woman was brought in by EMS, wrapped in a blanket and heavily wounded. She had been found by the roadside. EMS left her wrapped because she cried out every time they tried to unwrap her, and they decided it would be quicker to bring her to us than to struggle with her outside. She had clearly been severely harmed, making it hard to distinguish between her soaked clothes and the blanket. After taking her vitals and attempting to build rapport, she was still partially covered when she simply said, "him," while glancing to her side. I slowly pulled the blanket back to reveal a child. I don't recall what happened next. I believe I've suppressed that memory. There's the unsettling, smiling gaze of a large psychiatric patient who was incredibly calm as I helped him settle in. After a few moments, he uttered a threat I barely heard, began to move, and was then restrained by a few police officers while I sedated him. I later learned he was with me because authorities found him with his mother, whose head was in another room, along with his machete. The last one that comes to mind involved a patient who was reportedly very ill and connected to various medical devices. I was performing an assessment on the sleeping patient while alone in my trauma room. Another nurse was just on the other side of the curtain. I was conducting my assessment peacefully when the patient opened their eyes, apologized, and began to hurt me with the wires. The other nurse heard the quiet struggle and quickly came to my aid. She was an experienced nurse, and the way she managed to restrain a violent patient with the bed sheets convinced me she was incredibly resourceful. Story 17. As a psychiatrist, the most frightening patient encounter of my career occurred during my training rotation at the county hospital, where we treated the most severely ill and acute psychiatric patients. One morning during rounds, a very psychotic patient became extremely agitated. I watched in horror as he punched through the plexiglass window of the nurse's station, clearly targeting one of my colleagues. I quickly directed the medical students to safety and joined my colleagues and the nurses to manage the situation. This patient then harmed one of the police officers who rushed to our aid and proceeded to break open the doors to the psychiatric unit. It became an all-hands-on-deck emergency, and eventually we were able to restrain him. I'd never seen such fear in the eyes of the nurses before, and these were seasoned professionals accustomed to aggressive psychotic patients. My second most frightening encounter happened one night while I was on call at the same unit. A tall, very large male patient was requesting to leave against medical advice, AMA, after midnight. He was psychotic and not safe to be discharged. He spoke in a disjointed way, and I noticed a distinct twinkle in his eyes, indicating he was experiencing hallucinations while speaking to me. I swiftly backed away and took refuge inside the nurse's station. A second later, I realized I had narrowly avoided being physically harmed. He began aggressively banging on the nurse's station plexiglass, shouting angrily. Story 18. During my first year of psychiatry residency, I cared for a 19-year-old male patient who struggled with depression and had been admitted to my ward a couple of times. Afterward, he began attending regular follow-up appointments and was doing well. One day, he visited the ward to express his gratitude, bringing us sweets and thanking us for everything. It was a very proud moment for me as he was one of my first patients in the field of psychiatry. That same night, I was on call. Around 3 a.m., I went to the main entrance to collect my food. I noticed a car heading towards the ER with legs protruding from it. I felt a sense of recognition, believing I knew those pants, so I walked towards the ER to see who it might be. He had ended it all that night. No one had suspected it, not his family, not us. It still haunts me at times. And if any of these stories are getting to you, don't forget to hit that subscribe and like button for more videos just like this. Story 19. I had a patient in my ICU who was a familiar face. She would come to us, get well enough to go to a skilled nursing facility, SNF, then get sick there and return to our ICU. This cycle repeated many times, several times, and I want to be clear that it was due to her disease progression, not any fault of the SNF. It was an expected and unavoidable part of her condition. One day, she was my patient again, and the doctor had already arranged her discharge back to the SNF. She was fairly lucid, a little pleasantly confused, but still able to tell me where she was, why she was there, and the current year. As I was chatting with her, she said, "I'm going home today." I clarified that she wasn't going to her personal house, but back to the SNF. She waved me off and insisted, "No, I'm going home, not back there, I'm going home." Her family arrived and the conversation was similar. They tried to help her understand she wasn't returning to her house, but she maintained, "Yeah, I'm not going to my house, I'm going home." She even waved down strangers passing her room, joyfully telling them she was going home today and inviting them to say goodbye and give her a hug. She was clearly at peace with her impending departure. In the middle of me trying to explain again that I wasn't sending her to her house but to the SNF and that transport was on its way, her eyes rolled back and she passed away. I should have realized she was a devout Christian, and in many churches, passing away is often referred to as being called home. I should have caught that nuance. She was serious. She went home. She knew and was trying to tell us. She wasn't scared. She was happy, telling everyone goodbye, even strangers. She was ready and she made her exit. Story 20. As a nurse in a pediatric cardiac ICU, I'm used to situations escalating with little to no warning. Children can compensate remarkably well until their condition takes a sudden turn for the worse. I once had a 3-year-old patient admitted with a heart rate consistently in the 210s, and nothing we tried brought it back into an acceptable range. We'd administer medication, her heart rate would briefly normalize, then she'd revert to an extremely rapid rhythm. She kept drifting off to sleep only to suddenly jolt awake and scream, clearly terrified. She would then fight to stay awake until she was nearly exhausted. This cycle repeated itself endlessly. I had a terrible feeling about this patient and communicated my concerns to the team, so we weren't entirely caught off guard by what followed. Close to the change of shift, she abruptly sat up from a deep sleep, screamed, and then collapsed. She had no pulse and wasn't breathing. We initiated emergency procedures, ultimately placing her on ECMO. Another time, a 3 or 4 month old patient was inconsolably fussy from the moment my shift began one morning. He was crying relentlessly and his heart rhythm was fluctuating, despite having been previously managed with medication. Clinically, he seemed otherwise stable. He had an IV leak overnight that caused a small amount of irritating fluid to enter the skin of his arm, so I requested a dose of pain medicine to ensure he wasn't experiencing untreated discomfort. There was no change. He continued to cry. I had 2 patients that day, and I remember going into the other patient's room, administering medications, performing my checks, and completing my assessment as early as I could. I even warned the parent at the bedside that I might become very busy next door, purely based on a gut feeling. Sure enough, as I finished giving my happy, stable patient his medications, I looked over and saw that my other patient's oxygen saturation had dropped to the 60s. I rushed over, applied oxygen, called the provider, and when I listened with a stethoscope, I realized he had lost flow to his lungs. We nearly had to place him on ECMO, but we managed to emergently intubate him and get him to the cath lab to stent open structures to restore flow to his lungs. He was discharged from the hospital a week later with no lasting effects. Panic babies tend to make me feel panic myself. Story 21. I'm not a medical professional, but I once found myself in an emergency room one night after getting a concussion at summer camp. It was around midnight in a quiet, rural small town, and the ER seemed empty. I was sitting there with some counselors and a fellow camper who had come with me. Suddenly, an eerie voice from the other side of the curtain broke the silence. "I'm still here." We hadn't realized there was another patient nearby, and we all exchanged surprised glances. Then the voice continued, "I can hear you." Nothing else followed. While certainly not as frightening as some other stories, it was quite jolting to my teenage mind at the time. Story 22. I'm not a medical professional, but I recall a conversation with my grandmother after one of her sisters passed away. My grandma told me she had been on the phone with her sister, and her sister started speaking as if their departed father was present in the room with her. That's when Grandma knew her sister wouldn't be with them much longer. My great aunt passed away a few days later. Then my grandma looked directly at me and said, "That's how you'll know when it's my time. If I ever start talking to your grandfather or your late Aunt Margaret, you'll know I'm about to pass." 20 years later, I had moved out of town and was speaking with my mother. Grandma had reached a point where she needed constant care and was living with one of my mother's sisters. Mom called me to say that Grandma had been admitted to a nursing home that night because she was starting to hallucinate. She was having full conversations not only with her late husband, but also with several other departed relatives. I felt a chill and told my mom, "Mom, it's her time. She won't make it through the night." Time she passed away, the exact moment I felt that chill. Story 23. During my 3rd year psychiatry rotation, I was sent to interview a young, very muscular, and physically imposing male patient who had arrived in the ER. I couldn't get him to communicate, but then he suddenly walked over to me in the small room we were in and took the pens out of my coat pocket. As vivid, unsettling images flashed through my mind, he simply returned to his seat. I calmly but rather quickly left the room and moved on to other tasks. Perhaps an hour later, I witnessed 4 police officers restraining him on the ground. I saw him again on the ward a few days later and he apologized. I wish I could remember his diagnosis. Story 24. I'm not a doctor, but a couple of years ago, I had a hospital stay due to a flare up of my Crohn's disease. While a first year doctor was examining me, I casually mentioned that I had this persistent, unsettling feeling, like something was about to go wrong, a heavy sensation deep in my chest. I've never seen someone's head turn up so quickly. It turns out that an impending sense of doom is a recognized symptom and can indicate a serious medical event like an impending heart attack or anaphylaxis. Thankfully, I was fine, and that unsettling feeling completely disappeared as soon as I started my biologic medication. It was a wild experience. Story 25. When I was a first year nursing student working as a nursing extern, we had a patient with a mental disorder. He was a very odd but sweet man. I recall some mornings while taking his vitals, he would tell me, "You're the only one who's nice to me. Everyone doesn't like me here." I knew this was true as I'd often hear the nurses speaking negatively about him, sometimes with reason, but it was still unkind. This patient had an ostomy, and as a first year nursing student, I knew absolutely nothing about them. At that point in school, we were literally just learning hand hygiene. However, I did notice that his ostomy pouch was always empty and never collected waste. I found this unusual. I would feel his stomach and observe that he was extremely distended. I reported this to his nurse multiple times throughout the week, but I was always made to feel foolish because they claimed they were already checking it. To summarize a long and difficult situation, when I came in for my next shift, I learned he had developed a blockage. He was a DNR patient and was very ill to begin with, but this was not how his end was supposed to be. I think about him often and feel profound sadness when I consider how he must have felt abandoned in the hospital and that this was the outcome. Story 26. Physician here, not necessarily the scariest, but have had a few patients with fixation start injecting substances into their hips due to lack of other access. Creates incredibly nasty infections. The worst part is it never seems to affect them. Another situation that comes to mind is a 21-year-old male with AIDS who came to me with some sort of wildly metastatic fungal process in his lungs. He'd been having intimacy with multiple females despite knowing he had HIV, but he didn't care. He didn't even mind what condition he had, just wanted to go home and do more of the same. Feels bad for the people he's with. Story 27. This isn't a scary story, but it definitely still stays with me, and I think of her often. I was caring for a 16-year-old with metastatic relapse Ewing's sarcoma. After informing her parents that there was no cure and recommending only comfort care, I typically let families decide if they want to tell their child or if they'd prefer me to. This particular family asked me to deliver the news given the good relationship we had established. After explaining everything, she looked at me with such immense terror in her eyes and asked, "Am I going to pass away?" That was the hardest day of my career so far. I think of her often. She ultimately had a comfortable and peaceful passing, and I'm proud that I could at least provide her with that. Story 28. I'm a speech language pathologist, not a doctor, but I felt this experience was worth sharing. It's truly astounding how many children I've worked with who have been diagnosed with severe PTSD due to trauma from a parent or family member. This is distinct from the infants and toddlers I've seen who were substance fixated due to their birth mothers. Most of these children recounted in vivid detail and without prompting what had happened to them and their siblings as casually as if they were discussing the weather on a normal Tuesday afternoon. The oldest patient was 10, the youngest was 2 years old, but most had endured repeated mistreatment since birth or for most of their young lives, often by multiple family members. I can never forget those children and the stories they shared with me during our sessions. Story 29. I'm not a doctor, but I'm pretty sure I gave an MD the fright of his life. When I was about 10, a friend threw what I'll call a jagged ice rock at me, catching me right in the eye. I won't go into specifics, but the injury was quite severe, requiring a trip to the hospital. Fortunately, it looked worse than it was, and I ended up recovering fully. The injury involved a lot of red liquid, and the doctors were concerned about potential damage to my retina. It was also the peak of flu season, so as I was being wheeled through the hospital corridors, I saw people sitting on the floor with their backs against the walls, creating a scene like something out of a Stephen King novel. The nurse pushing my gurney kept telling me to keep my eyes closed, and every time I tried to peek, he would gently but firmly push my forehead down. The instruction to keep my eyes closed for fear of permanent blindness was deeply ingrained. Because the hospital was packed, there was no empty room for me, so the nurse placed me in a storage room, the kind where they keep routine medical supplies like bandages and tape. It was barely larger than a broom closet. He then told my brother, who had brought me to the hospital, that it would be a good time to get coffee. So they both left this 10-year-old, who was convinced he'd go blind if he opened his eyes, alone in what was essentially a closet. And the nurse even turned off the light when he left. After a few tense moments of my body trying to decide between various unpleasant reactions on the hospital gurney, I heard the door open. The light switched on, followed by a brief silence. I presume the person quickly registered a 6-foot gurney in a 6-foot 1-inch room. Then I heard rummaging through the supply bins around me. Again, I cannot emphasize enough how committed I was to keeping my eyes closed, believing my sight depended on it. I literally willed every muscle in my body to remain as still and tense as possible. Then the person in the room dropped something on me and I flinched. I thought it was a reasonable reaction. The person in the room, however, disagreed, screaming at the top of his lungs and bolting out. At no point did I open my eyes. My brother came in a few moments later, laughing hysterically. It turned out the room I was in was also used to store departed patients who didn't survive past the ER while waiting for someone from the morgue to retrieve them. The person who had entered was a doctor simply trying to get medical supplies, and he had presumed I was one of them. When I moved, it gave him the shock of his life. Oh, how I laughed about it years later. In that specific moment, when I realized I was in-person storage, I did decide what it wanted to do on the gurney. I'll spare you the details, as that experience was almost as traumatic as the eye injury itself. Story 30. One particularly scary incident involved a notoriously violent inmate who managed to slip out of his restraints in the ED room and began harming the correctional officer assigned to him. Being a relatively large person, I rushed in to assist. For what felt like an hour, it was a full-blown struggle. The inmate was even trying to grab the CO's gun. I honestly thought one of us was going to be seriously injured, or worse. We tried to press charges, but in court the judge stated that this was accepted as part of my job. This was my first experience with the realities of the legal system and the feeling that healthcare workers aren't fully supported. It profoundly changed my view on my county and state. This was also the only time I've ever had to physically strike a patient in self-defense, though, like many of us in the ED. I have countless stories of combative patients. This, unfortunately, is a glimpse into life in the ED. Story 31. Not a doctor, but a CNA, I had two experiences that truly unnerved me. The nursing facility where I worked was once a farm with a history stretching back to at least the early 1900s. Local lore claimed a young man had been tragically ended there by a tractor. One time, I was providing care for a woman who was facing a terminal illness but remained quite lucid. She looked at me and said, "I bet you're stronger than him." Wanting to playfully boast to the male nurses, I asked her, "Who?" She replied, "That boy." Again, thinking she was referring to one of the young male nurses, all of whom she knew by name, I pressed, "What boy?" She then stated, "That boy sitting in the chair behind you." There was no one else in the room. I've never left a room so quickly in my life. I still get chills recounting it. Often, before residents pass away, they would mention seeing a boy and a black dog. One night, a call light flicked on, and the nurse and I went into another lady's room. This woman was 100% lucid and barely needed assistance. We often went in together just to chat with her. She greeted us with, "Hey girls, where did that big black dog go?" We asked, "What black dog?" She responded, "The black dog that was just lying in my bed. His owner brought him in and then he ran out." This obviously freaked us out because usually only residents who were very close to passing spoke this way, and this lady was perfectly fine. We eventually left. A few hours later, she fell and sustained a head injury on her metal table. It was totally unexpected. She passed away as soon as she got into the ambulance. Story 32. As a medical student during a psychiatric rotation, I experienced an unsettling incident. One of the patients unexpectedly used a chair to hit a fellow medical student on the back of her head. Our group, consisting of 5 or 6 students, was rounding at the back of the team, all facing another patient's bed, so we didn't see it coming. It seemed completely random and not targeted at any of us in particular. The student was promptly escorted out and appeared to have no visible injuries. The patient wasn't particularly strong or in a psychotic rage, so it wasn't a forceful blow. We didn't think much more of it at the time and went our separate ways, considering it just another story to share over drinks at the end of the rotation. However, the student who was inadvertently hit suffered from a Chiari malformation and had undergone elective aneurysmal repair about 6 months prior. About a week after this incident, I received a call from our hospital supervisor asking if we had heard from her, as she hadn't attended her placement for a few days, which was very uncharacteristic. Police were called to conduct a welfare check, and it was discovered that she had passed away in her sleep. I often wonder if that patient had hit any of the other students instead, or if we had been paying more attention. Story 33. I'm not a doctor, but as a former correctional officer, I experienced an inmate's passing while on a hospital run with my partner. He looked me in the eyes as he lay chained in his bed and told me he was going to pass away that night, saying he could feel it. I tried to lighten the mood, telling him to relax, reassuring him he was in a hospital where he'd be cared for. and suggesting he just watch some TV to distract himself. He passed away within 3 hours of that conversation. After finally relaxing and even making a few jokes about himself trying to run away, he was missing a leg and the stump was severely infected. He quietly passed away. Story 34. I'm not a doctor, but I once encountered a woman who seemed to be experiencing a complete mental breakdown. I was working reception at a housing association when she came in, asking if we could provide her with a house. She had no documentation, and I explained that she would need identification, a letter with a current address, and so on. She responded that she couldn't because she lived in London, which was about 140 miles away from Liverpool, where we were located. She explained that she wanted to move to Liverpool because she liked the TV show Brookside, and she could no longer cope with caring for her sick mother. I can't recall if her mother had dementia or cancer, but the woman was essentially her full-time caregiver. We told her there was nothing we could do for her in terms of housing and urged her to return home to seek mental health treatment. We managed to convince her to book the next bus back to London, but it was departing within the hour, meaning she needed to leave immediately. We then watched her depart and head to a McDonald's across the road, talking to people and wandering around. She missed the bus. Every now and then, I can't help but think about that poor woman. I truly hope she eventually received the help she needed. Story 35. As an ICU RN, I've had my share of intense moments. I once cared for a man going through severe withdrawal. He arrived in leather restraints, which technically didn't necessitate an ICU stay. The every 15-minute charting requirement for a floor nurse makes it impossible. But we opted to give him IV phenobarbital immediately to sedate him, so he remained in our unit. Because I had a good relationship with the doctor I was working with, he received a high dose almost as soon as he arrived from the floor transfer. He slept for a couple hours, and management made me switch him to soft restraints. Predictably, he broke those when he woke up. Fortunately, while his 6'2" frame was shouting at the top of his lungs and pacing the room, his sitter and I were able to de-escalate the situation enough to remedicate him for more sedation. We had security positioned around the corner out of his line of sight, but if he had decided to come at me, he would have covered the distance in a split second and likely caused serious harm. I had a heavy family room chair in my path, which we had moved for the sitter, and I figured it might buy me enough time to sprint to security if he decided he didn't like me. Maybe. My boss did overhear me using some strong language with the patient, but sometimes you have to read the room and speak a patient's language so they don't feel patronized. So that was a little unexpected moment for my boss. Also, any dementia patient still driving is genuinely concerning. Story 36. 23 years ago, in a remote flying community up north, I received a call to the clinic at 2 a.m. A woman had suddenly lost her sight and her son was experiencing retching and seizures. Just 2 days prior, this young man had playfully teased me at the grocery store because I couldn't reach the top shelf. Now, he was looking at me with the most sorrowful, pleading expression. He passed away within the next 10 minutes and there was absolutely nothing we could do. Over the next 10 hours, people were brought in from cars, shacks, houses, and dishes. Someone had mixed substances into drinks at a party. We lost 3 individuals that day and others have since succumbed to the effects. It remains truly the most terrifying day in my nearly 30-year career. And if any of these stories got to you, here's more for you. YouTube thinks you're gonna love this. I'll catch you in that video.